Let's start with that New York Times report that from January on, top public health officials were warning the president about the threat from the pandemic and that he did not take action until mid-March. One, what's your reaction to the report, and how much did those lost weeks cost us?
So, Chris, I can't say who in the administration knew what and when, but I would say that that article reinforces what we've heard along the way, which is that many in the administration were very worried about this as early as January and February, and that seems pretty clear now. And I'd also say that if we had acted on some of those warnings earlier, we would be in a much better position in terms of diagnostics and possibly masks and personal protective equipment and getting our hospitals ready.
When you say be in a much better position, if we had imposed social distancing, stay at home at the end of January or in early February, would there be a dramatically smaller number of cases and deaths?
Yeah, I'm not sure we would have been able to get the collective political will to do it as early as January or February because we didn't really know when we had cases. But if we had done a lot of diagnostic testing earlier, it's possible we would have seen enough disease to get the will to do that in February. And yes, the earlier we put in place social distancing, the earlier we would have gotten to a peak and to a better place where we can start to think about responding.